rolling a hospital bed.
Now more than ever, adoption of new technologies is essential to keep frontline clinicians and care providers safe, while continuing to provide the highest quality care to patients.
Temperature screening.
Microsoft Teams provides frontline healthcare providers with the tools they need to streamline patient care, securely message to collaborate across teams, and maximize productive workflows, all in one place.
A nurse looks at a physician's tablet.
Dr. Robert Tolbert is a clinician at Contoso Hospital. While he is on morning rounds, he receives a priority notification on his mobile device, which is securely logged into Teams. The care team's head nurse is concerned about a patient's swollen extremity. Dr. Tolbert's diagnosis, a case of extremity edema, could be indicative of a more serious issue due to the patient's pre-existing condition of hypertension.
A photo of a swollen ankle.
He needs to consult with a specialist right away, but doesn't know who is on duty. He types in on-call cardiologist, and shift-based tags identifies the name of the on-call doctors and routes the message. With secure messaging in Teams, the doctors conduct their conversation through a platform that supports compliance with HIPAA and other regulations. They consult on a diagnosis. Dr. Tolbert supplies orders for a treatment plan and sends a message to the head nurse to assign a care plan, all from his mobile device, saving him valuable time on the go. Charlotte Walton is a head nurse on the team. With pre-installed healthcare templates and lists, she assigns the patient's care plan, allowing the entire care team to view the updates. Using lists, the team can also run meetings, organize work, and collaborate on patients, keeping the care team in sync. After assigning care plans, Nurse Charlotte assesses staff availability for the week. After checking patient census predictions, she notes the unit will be short on staff. Using shifts in Teams, she creates 3 open shifts and shares them with the nursing staff. As nurses send requests to fill the shifts, Nurse Charlotte receives notifications, approves them, and updates the schedule.
The new shifts appear in the Monday column.
Looking further ahead, a few patients have upcoming discharge dates. Nurse Charlotte uses tasks in Teams to manage assignments for the entire care team. She adds discharge planning to a nurse's to-do list, ensuring patients' requirements are met so they are able to be discharged as scheduled.
Clicking Send.
Miguel Garcia is a float nurse on the care team. He reviews discharge plans on his task list, which includes a request for a bariatric wheelchair. Since this equipment is specialized, approval is required by a clinician to place the order. Using approvals in Teams, Miguel routes a request to the patient's clinician. Once approved, the special order is completed and arrives by the discharge date.
Status approved.
Nurse Miguel moves on to schedule the patient's follow-up visit 2 weeks post-discharge. Bookings in Teams allows a view of multiple clinicians' Outlook calendars to find an open slot to schedule a virtual visit. Customized appointment confirmations and reminders will automatically be sent to the patient by email and text message. On the day of the appointment, the patient can easily join the virtual appointment via web browser on any device.
Joining on a smartphone.
Care teams need technology that enables them to provide patients with the best care in the safest environments.
Using a stethoscope.
Microsoft Teams empowers frontline healthcare providers with the tools they need to improve care team collaboration and virtual health.
Microsoft 365. Microsoft.